Good morning. I'm Dr. Carol Henricks. I'm a neurologist. I'm in private practice in Tucson. I have my neurology office, and I also have a treatment center. I'm not contracted with any insurance. Everything I do is self-pay. About half of the work that I do during every day has to do with military veterans and treating them for their injuries. Some of you might have been at my presentation in New Orleans in 2017, where I was talking about military TBI, the undiagnosed military TBI, and the problems that it's causing for veterans. As I've continued to treat veterans for the past 15 years, what I had noticed is that some of my veterans were much sicker, much more ill. It was taking a lot more treatment and care, and they continued to get repeatedly ill during their course of recovery, and I knew something different was going on. And that's when I discovered that I had not been asking questions about burn pit exposure because I didn't know about it. It hadn't even occurred to me that so many veterans had this kind of exposure. And so I'm going to talk a little bit about the very serious and significant health consequences of all that toxic burn pit exposure that so many of our military veterans who were deployed have experienced. The military recorded 247 burn pits in Iraq and Afghanistan. The burn pits burned everything. They burned human waste, medical waste, organic materials, inorganic materials, and many of the veterans who I have talked to talked about breathing this thick black smoke 24/7. The burn pits were very close to where the military veterans were stationed, where they were sleeping, where they were working. Dr. Bob, who you'll hear later in this presentation, said the burn pit was only 25 yards away from where he was sleeping. Of course, the toxic burn pit material, as it's in the air, it can touch your skin, irritate your mucous membranes. You breathe it in, it gets into your lungs, it irritates your oral passageways, gets into your GI tract in every way. So there's many ways that you experience this toxic exposure. And this is just a real video clip of a burn pit. And you see that everything was burned in the burn pits. And when you think about it, there's about 100,000 chemicals that are present in the world now that were not present in the world 100 years ago. And then when we burn them and aerosolize them, it increases the exposure. When you see all the things that are burned, it gives the people who were exposed a very complex toxic exposure. So we already have a pretty good idea about the toxic effects of burning these kind of materials because we know what happens to firemen. And the firemen union has taken steps to try to minimize the toxic exposure that firemen get. I talked to some firemen that are involved with the Firemen's Union, and it used to be that when they came back from a fire, they would put their turnout uniform, which this fireman is wearing, they used to put it at their bedside and go to sleep. But it turned out that was giving them a lot of extra toxic exposure. So then they started hosing them down before they went into the firehouse, and now they hose them down at the scene because there's too much toxic exposure. But imagine that the military veterans are exposed to 24/7 burning toxic materials. We know the devastating health effects that came from Agent Orange, and we know the devastating health effects that the 9/11 first responders experience. So we've seen all of the consequences of toxic exposure play out over and over and over again. There's a known list of cancers that occur. We know that people develop irritable bowel, they develop severe pulmonary disease, endocrine disorders, and autoimmune disorders. This has all been seen, but with the complexity of the toxic exposure that veterans experience from the burn pits, but also veterans experience heavy metal toxicity due to ammunition and guns and things they're exposed to, which includes arsenic, mercury, lead, and cadmium, plus the toxicity from the vaccinations they receive. It's a very complex kind of poisoning that we see. And many of the things that they are exposed to are hormone disruptors. I work with a neuropharmacologist, neurotoxicologist. I work also with somebody who consults with us on endocrine function. There's not a single male military veteran that we've seen in our clinic that doesn't have their testosterone levels bottomed out for a variety of reasons.
Hi, my name is Mike. I'm a retired Army physician assistant. I was in the U.S. Army Reserve and the Army National Guard and deployed to Afghanistan in 2003 and 2004, and again in 2010 to Iraq. While I was there, I was exposed to toxic smoke from burn pits that ran around the clock 7 days a week. The toxic nature of the smoke from these burn pits did a lot of damage to many service members who were exposed, and in my case, as well as many others, caused development of constrictive bronchiolitis, which is a lung disease that affects the ability to breathe enough air into the lungs. I've always been a runner, and while I was in Afghanistan, I ran the 2-mile physical fitness test in less than 14 minutes, which is my best time in many, many years. After returning home from 10 and a half months of deployment there and exposure to the toxic smoke, I quickly saw my run times increase to as much as 19 minutes or more without any reduction in training. The reason the times got so long was because of developing shortness of breath while running. Things became worse after the deployment to Iraq, and that finally led to undergo a lung biopsy, which confirmed the diagnosis of constrictive bronchiolitis. This year we learned about hyperbaric oxygen treatment, and were able to travel to Tucson and receive treatment from Dr. Henricks and her staff. While there, I went under 58 hyperbaric oxygen treatments, and also received IV therapy and was started on several supplements. The treatment has helped in so many ways, but specifically I've seen improvement in my ability to exercise more with less shortness of breath. There are so many conditions that hyperbaric oxygen therapy can help, and I can't say enough about the benefits I've seen after treatment. I would definitely recommend to anyone who is having difficulty after deployment overseas and exposure to not only toxic smoke, but also explosions from IEDs and other issues, to look into hyperbaric oxygen therapy as a way to help. Thank you.
So Michael was part of a sentinel group of military veterans who had toxic exposure and lung disease, who underwent the lung biopsy and were discovered to have constrictive bronchiolitis. This has still not been acknowledged by the military as being connected to the burn pits or to their service. And that is certainly part of the issue, is we need to acknowledge the injuries that have occurred and make sure that they get treated, because there is no known treatment for constrictive bronchiolitis. They tell people to just get on an oxygen concentrator and do their best. Traditional medicine has nothing to offer these veterans. Michael actually, when he first came to my clinic, he would come in, walk into the clinic, walk in, walk down the hall and sit down. And he got so much better during the time that he was getting treated that he could go for hikes in the desert with his wife and walk a mile at a time. So we did see a great clinical improvement, but as to whether it will be sustained and what his repeat biopsy will show, I don't know. He just left a couple weeks ago, and all that kind of testing is pending. And I'm telling you this because, this is all new information. This is not, there's no research to quote or, a lot of other data to talk about. This is just what I am seeing in my clinic. So the next testimonial is also somebody that came to my clinic. He had a very unusual clinical presentation. When he was deployed, he became progressively weaker over a number of weeks to months, actually more like months, and he had trouble with visual focus, and it finally got so bad that he got transferred to a hospital in Israel, and I'll let him tell his story.
My name is Robert Sexton, and I'm a patient at North Star Hyperbaric Clinic. I am a retired physician who returned to the military in 2007 at the age of 57 years old, and was deployed in 2008 and 2009 to Iraq with the U.S. Army Medical Corps. In Iraq, after about 8 months, I was diagnosed with Guillain-Barré syndrome and treated with plasmapheresis. I had some of the symptoms that were classical, but the duration was atypical in that it was very long duration of the onset of symptoms. My CSF was slightly abnormal with increased protein and normal white cell count, and my nerve conduction studies were abnormal. Many of my symptoms were typical of Guillain-Barré syndrome, and I had a halt in the progression of the disease with the plasmapheresis. After then, I was transferred to Walter Reed Hospital for further diagnosis and treatment, and then transferred home for further recuperation. The recuperation did happen, and by 2011, the beginning, January, I was deployed to Afghanistan. I remained in Afghanistan for a year during the deployment, and it was attached to a Special Forces group, Green Beret team on the outskirts and rural areas, about 30 to 40 miles southwest of Kandahar. During that time, I had no symptoms and came home in January 2012, and by the end of 2012, I had a gradual recurrence of most of my symptoms that were original in 2009. The only exception was a new onset of eye muscle paralysis, which required in-hospital surgery. I came up to the North Star Hyperbaric Clinic to see my neurologist, Dr. Carol Henricks, and she prescribed an aggressive regimen of hyperbaric oxygen treatments. And these were about 2 a day for the first week or two, and then off to about 1 a day. I've had about 80 or 90 treatments. And for the first maybe 7 or 8 treatments, there was no difference. But after that, the improvement was very dramatic. I just couldn't believe it was that dramatic. And so that really helped. I continued my treatments, and with continued less dramatic improvement. And to this day, I'm still doing treatments every once in a while. And but I'm able to drive now after my eye surgery, and pretty much work as I used to before I came up here and before the onset of my symptoms in 2013. My neurologist believes that rather than Guillain-Barré syndrome, I may have had toxic exposure to the burn pits that I was exposed to in Iraq and Afghanistan. These burn pits, since we were not on the big Camp Victory or the big bases, and we were mostly out in the rural areas, these burn pits were very close, and they burned 24/7. And at the farthest, I was maybe 50 yards away, and at the closest, maybe 10 yards away, through my 8 months in Iraq and through my 12 months in Afghanistan. I am now undergoing some treatment with some ancillary services at North Star Hyperbaric, and I seem to have gradual improvement so that I'm pretty much back to normal, about 90%. So I am thankful for the evaluation and treatment that I've received in this clinic, and I will continue to maintain my association.
So there's a lot more data about Dr. Bob's course of illness that makes us think that it was toxic rather than Guillain-Barré. However, his course of illness is very consistent with what we know about toxic exposures and neuropathy. And what I will show you next is some other testimonials. There is an organization called Burn Pit 360 that's fighting for the rights and for the health care of veterans that have been exposed to burn pits and all the toxins. And we are affiliated with them, but these are the testimonials that they've provided.
You're everything a parent could ask for in a child. You've been so wonderful.
I was a canine handler who had an explosive detection military working dog. My military working dog Rexo and I deployed to Iraq in 2008 individually as a dog team. During our 12-month deployment, I encountered 4 separate roadside bombs with concussion blasts and head trauma. One IED rendered me unconscious, and I was airlifted to the hospital in Balad, Iraq. Due to those life-changing events, I have been diagnosed with a traumatic brain injury, a toxic brain injury due to exposure to burn pits, seizures, a spinal cord injury, episodic and debilitating motor tics and tremors in my face and neck. As a result from a brain injury and toxic brain injury, I have a rare medical condition known as apraxia of the eyelid opening due to frontal temporal lobe damage and neurodegenerative retinal disease to both my eyes, which have left me visually impaired and functionally blind. For 13 months, as my conditions got worse, I sought care and treatment at the Loma Linda VA Medical Center in Southern California. After several emergency room visits, I was continually degraded, harassed, and blown off, repeatedly being told that my symptoms were psychological in nature. As my medical condition worsened, the caregiver program at the VA said I no longer qualified for a full-time caregiver, meaning now I only qualify for a part-time caregiver to drive me to appointments, assist with bathing, feeding, and other activities of daily living. To get anything fixed with the caregiver program has made me feel so worthless and burdensome to my family that I almost tried to commit suicide on June 30th. I'd like to thank my wife and mother for assisting me in writing down my thoughts and putting together this video so I can present them in a meaningful manner because of the effects of my traumatic brain injury and memory problems. It took me 2 days and 22 takes along with taping my eyelids open to bring you this presentation. I thank you for your time.
I am Maria Maddox, surviving spouse of Sergeant Brandon Maddox. He was stationed at Camp Scanning in Iraq from 2008 to 2009. Brandon passed away May 2013 from esophageal cancer stage 4. While stationed in Iraq, he was exposed to the burn pits near his sleeping quarters. Brandon and I went to the VA several times before someone listened to us and decided to do a workup. He was diagnosed with a rare terminal cancer, adenocarcinoma. I became Brandon's full-time caregiver at the time. We were also expecting our first child. Brandon lived for 10 months after being diagnosed. Our daughter Eva was only 5 months and was robbed of knowing her father. I only want the same benefits for her and I that the survivors of soldiers on active duty receive. It is frustrating to constantly feel like the forgotten voices. It feels as his service did not count.
Hello, my name is Rocio Tamayo, and this is my husband, Brian Alvarado. And I just want to say that Burn Pits 360 has helped us out a lot since the beginning. They made Rosie reach out to us and made us aware of the caregiving program, and also called the hospitals and spoke to the social worker to have them provide us with the application, and has always followed up with us in reference to Brian's health, the help that they provide, and just reaching out to us is by far the best.
While I was in Iraq, both times we always used burn pits. We had a burn pit within 50 yards of where we slept and where we worked and where we ate. And then in 2009, 2010, I was at the Victory Base Complex at Camp Stryker at the Baghdad International Airport. And you could smell the burn pit. You couldn't see it. I never saw it. But you could smell it every morning. It's like you'd wake up and walk outside, and that's the first thing that you would smell. In October 2009, before I left Iraq, I started to cough. The doctors thought it was just allergies, so they gave me medicine. And when I got back to the States, the doctor at Fort Stewart, Georgia said it was pneumonia. So they gave me medicine and sent me home. Followed up with my doctor a week later. He did an MRI on my lungs and seen that I had pulmonary fibrosis, nodules, and scarring in my lungs. Immediately he called Walter Reed after a lung biopsy at Walter Reed. They found out that I had titanium, magnesium, iron, and silica in my lungs. The problem I have with the VA is that they've denied me 4 or 5 times for housing grant, because with breathing issues, you have to pretty much modify your house. We've had to use other groups that have graciously helped us out redo our bathroom to make it ADA qualified. I love the military. I'd go back right now if I had a good set of lungs. And I'm not speaking bad of anybody. I just need somebody at the Pentagon or wherever to say, guess what, guys, we did this and we need to help these guys and girls. We just need help. There's many soldiers out there that had this issue. Some not as bad as me, some worse. And we need help. Thank you very much.
And certainly, toxic exposure complicates the recovery from traumatic brain injury, which is what I spoke about in New Orleans. Because if you have a toxic brain, if you have a lot of toxicity, if you have what's called metabolic encephalopathy, in other words, brain dysfunction due to all the toxic chemicals in your brain cannot heal itself. So that's what really brings me into the picture in terms of paying attention to the burn pits and the burn pit illness that goes along with it. But we know that traumatic brain injury affects the hypothalamic pituitary axis, which affects endocrine function. All these chemicals are endocrine disruptors. There is no screening or standard of care that's going on in military medicine or at the VA to screen the veterans for this kind of toxic exposure or, of course, for their traumatic brain injury. And so in partnering with Burn Pit 360, that's what we're hoping to do, is for a screening program to be set up so we can be aware of who has been affected and start with some kind of viable treatment. So our approach to treating veterans, to treating any veteran actually, is I'm the first step, doing the interview and exam and looking at what kind of exposure they have. And now, of course, I ask a lot more questions about burn pit exposure. The diagnostic testing is laboratory studies, thermography, and EEG for people that might have metabolic encephalopathy. And our treatments are hyperbaric oxygen therapy, far infrared sauna, and nutrient optimization, with protocols designed by my neuropharmacologist, neurotoxicologist colleague, Dr. Tim Marshall. So our lab evaluation includes CBC, complete blood count, complete metabolic profile, a nutrient screen. Dr. Marshall and I have found, as we've treated patients, we almost always find some kind of nutritional deficiencies as well as toxicities. Hair analysis for heavy metals, and as I said, military veterans tend to have high levels of those 4 heavy metals that I mentioned: lead, cadmium, mercury, and arsenic. An endocrine screen, your hypothalamic pituitary axis, if you open your mouth and point your finger toward the back of your throat, your hypothalamic pituitary axis is right in the back of your mouth. And if your mouth is open when there's a blast, the impact is closer to that area of the brain. But anyway, we very commonly find endocrine abnormalities in our veterans. The most exciting part for us in terms of the lab evaluation is Great Plains Laboratory Toxicity Profile, which is a very new kind of testing, and it tests for organic and inorganic toxins, and we never had that ability before. So now we're going to be able to test people and say, oh, with all these toxins, this is a reflection of burn pit exposure. So it's kind of a brand new era of testing. This is a tool that is not commonly used by traditional medicine. It's called thermography. And thermography looks at the heat patterns in your body. And the good thing about thermography is it's totally non-invasive. Thermography doesn't do anything to anybody. You stand in a cold, dark room. The technician has a thermography camera, and they look at you from all different angles, and they can see localized metabolic changes. And if you continue to follow someone and see evolving changes in the heat pattern in their body, you can often detect a cancer or a cancer evolving. And there has been some studies using thermography for breast cancer or to look for recurrent breast cancer, because you're probably aware that repeated mammography puts women at risk. So, and that's invasive because you're using a CAT scan to repeatedly look at tissue. But thermography, you could do it multiple times a day because you're not doing anything to the patient. You're just looking at the heat patterns in their bodies. So when they follow up on these patients, they can look every 3 months and see if there's a change in the metabolic pattern in that tissue, and if there might be a cancer evolving, so they can be proactive and do a biopsy or do something to discover early a cancer that's developing. So this is part of what we're going to be initiating as part of our evaluation program. It has not been done yet. But what we would like to do, because there's so many known cancers that are associated with firemen, and now, of course, 9/11 rescuers, and with our veterans, there's known cancers with this toxic smoke exposure. We can try to follow people with a thermogram and see if they have an evolving pattern so we can intervene early. EEG is electroencephalogram. You put recording electrodes all over somebody's head, and when you have a lot of toxicity in brain tissue, and remember, toxins tend to be stored in fat. So we have fatty coatings around all of our nerves, and so toxins tend to be stored in that fat that's around the nerves, in our brain, in our spinal cord nerves, and of course in deep fat. But if you suspect that somebody has a lot of toxicity in their central nervous system, you can do this test. It's an EEG, and what you see, instead of the nice, pretty alpha waves that are up there, you see delta waves, big, slow waves, that shows you that there's a disturbance in the chemical and electrical communication in the brain. And I actually, this is just a side story. I've had a couple patients come to me who had gastric bypass surgery and lost quite a bit of weight. And, as they lost the weight, they lost the fat. They burned their fat. And there was a couple of them that had a toxic metabolic encephalopathy because the toxins were released from the fat, toxins they didn't know they had. And one patient had even ended up, before she saw me, but she ended up with a shunt in her head from brain swelling from the release of toxins. Okay. My favorite topic in the world that I could speak on for hours and hours and hours is hyperbaric oxygen therapy. So we know what hyperbaric oxygen therapy can do. When you enhance oxygen delivery by being under pressure, it increases your metabolic rate. It increases the metabolism in your fat and helps you to get rid of toxins, but of course it drives all the other healing responses in your body. At 1.5 atmospheres of pressure, when you're breathing 100% medical oxygen, you're enhancing oxygen availability 700%. We know that there's more than 2,200 intracellular reactions that are oxygen dependent. You have the direct healing effects. You have release of stem cells from bone marrow. You modify gene expression at a DNA level. There's been more than 8,300 genes that have been studied, and you upregulate the healing processes and downregulate the destructive and inflammatory processes. But it's been a very important part of the healing that we have done with our veteran population. We have a far infrared sauna. We start with the starting temperature is 120 degrees for 15 minutes, or in Tucson we call that going outside. But Dr. Tim Marshall, my colleague, is the one who manages the protocols for the far infrared sauna, along with the nutrient optimization programs that he does to help people detox. And we do a variety of IV therapies. We don't do things people commonly think of like EDTA. We do mostly healing IVs and soft tissue healing protocols, but that's a topic for another lecture. Magnesium and vitamin C are very important to our protocols. So, in support of Burn Pit 360, which is the organization we're partnering with to raise awareness, if you know a veteran who has burn pit exposure, please have them register on Burn Pit 360 and record their symptoms, because we're collecting data. There's more than 7,000 veterans that have registered. And you know how it is if you go to the VA websites and read about burn pit exposure, they say, yes, there's been some people exposed, but it's not really much of a problem. And if you go to the veteran sites, it's everybody's been exposed and we're having terrible symptoms. So we're trying to collect data. My slideshow is on my website, patriotclinicmovement.org. I have business cards with the website on it. If you would like to go and look at it, my notes will be there as well as a whole lot of other information that would go along with the slides, because I wasn't going to read lists of things to you during the presentation, but the information is all there. And I think most of it's already on the website, but it will be by the end of Monday. And this is the nonprofit that I started to help sponsor veterans that are treating. America's Mighty Warriors has been very good, and they are very much on board with everything we're doing to help veterans with burn pit exposure. And the whole focus of what we're doing is we're looking at veterans with a wide variety of symptoms who were maybe treated with a lot of medications at the VA, but we're looking for root causes so that we can truly heal them and help them to be healthy and well, rather than just overly medicated and sick for the rest of their life. So So that is the end of my presentation, if anyone has questions for me. And if anyone wants to talk to me privately at lunchtime, I'll be available.
Are you in touch with the firefighters at all? I mean, as sort of first responder firefighters, because it was only a few years ago they discovered that hydrogen cyanide is commonly produced in fires because of the synthetic plastics, and it was causing heart attacks in young firefighters.
I do have some connections to people with first responders and firemen, and we're going to give a seminar right before Veterans Day where we're including veterans and first responders here in Tucson. So hopefully we will share what we know with them about toxic exposures and also the TBI information. Yes.
On a side note, has there been any pressure brought to bear on the Veterans Administration?
Myself personally, I was invited to VA headquarters in August of 2017, and I talked to some top people there about my protocol and what I'm doing. And veteran Robin O'Bannon and I were at a small group meeting in March of last year where we talked about these problems, and we were meeting with top VA officials then. So they know we're here and they know what we're doing, but it really hasn't been moving forward, and our priority is to maybe try to create veteran-run Warrior Patriot clinics.
Well, I think the responsibility for that lay more on this side of the microphone, that we, the people of the United States, need to, maybe through our political representatives, light a fire under the VA so that they might be a little bit more supportive than it appears they are now.
Well, certainly I would like that to happen, but you know what I would say as somebody who treats veterans, we can't wait for them to respond. You know, there's too many people that are too desperate that need help now, so we need more of a grassroots effort. And that's what we're all about.
Cards.
Okay.
I live near a town of 25,000. After New Orleans, I went and talked to the hospital administrator because they were just starting a hyperbaric program. And, you know, you can imagine the numbers of patients so do you have any kind of break-in, particularly now that you've added this program? I mean, do you need like 20 patients to where you could go to someone and say, is this a viable program for you to start? I mean, I gave them the number. I mean, we now have a new administrator. So should I recommend the website to them, or should, if they might be interested, in other words, what might be the next step?
You know, the problem with hospital-affiliated hyperbaric chambers is they will not treat conditions that are so-called off-label, and there's only 13 recognized conditions because they can lose their JCO certification if they do. So it's only a freestanding center that is not hospital-bound that can treat off-label. That's another reason for wanting to have like a Warrior Patriot clinic that is separate from the hospital and the VA, is because of the administrative things. Now, the FDA did recognize that Dr. Paul Harch's work that was submitted about 4 years ago, he studied a group of veterans and proved that they improved in all of their cognitive functioning from their traumatic brain injuries with the hyperbaric care. But in a usual delay, deny, hope you die kind of way, they said, oh, well, you'll have to, test it at different pressures and oxygen concentrations and do all this research that will take 20 years to complete, instead of acknowledging that there is a crisis here and people that are desperate for treatment, and by not acknowledging that it's an effective therapy, there's so many people that will not get care. Okay.